And we'll have more on the climate crisis later in this hour, with a warning from the broadcaster Sir David Attenborough for all world leaders to act now at the COP26 summit. Let's return now to the news that the public sector pay freeze is to end in the UK. We can speak to Pat Cullen, Interim General Secretary and Chief Executive of the UK's Royal College of Nursing. Good to have you with us. Welcome to BBC News. And do you welcome this announcement of pay rises in the offing for public sector workers?
Well, any news of a pay rise for nursing staff so that they can care for their patients and we can track them back into the NHS and indeed into social care is very welcome. But we will wait with caution to see what happens tomorrow. That's really, really important. It can't just be another empty promise. It can't just be another publicity stunt or a headline. We do need to see an announcement tomorrow that in fact they are going to treat nurses decently and indeed all healthcare staff, and really show that through a significant pay rise, which I think every single one of them deserves and more.
And when you say a significant pay rise, how much do you think nurses' pay should go up in your view?
Well, our position with our members, and we've nearly 500,000 wonderful nursing staff in our membership, those nurses have made it clear that they deserve, and I absolutely believe that, a 12.5% pay rise. If you think from 2010, there's been £5,000 wiped off every single nursing staff's salary. So if £5,000 was taken off any of our salaries, I think we would find it very, very difficult to actually make ends meet, and that's what our nurses are telling us. And then with an announcement that the increase in the national insurance, is it any wonder that thousands of nurses are leaving the health service and social care, and more to come? And it is a really, really worrying time. Not just for nurses, but it's more worrying for patients who absolutely deserve nursing staff to be there to provide the care and treatment that our population has paid to for years and years, and they absolutely deserve it.
We must make mention of the fact, of course, that nurses were not included in the pay freeze of November 2020. They were offered a 3% rise in the summer, and I know the Royal College of Nurses were going to ballot for industrial action on that rise. What's the latest on that consultation with your members?
Well, sadly, our members feel that they've been pushed to that position. What I want to say, and having led the strike action in Northern Ireland, the first time in 105 years in our wonderful college's history, every nurse moves to that position with a heavy heart. And like what they did in Northern Ireland, they do that because they believe that government isn't listening. And it's not just about listening to the nurse, it's about listening to the patient, and it's about trying to bring the NHS back from the brink. So unfortunately, we've had to move to a position now where across 3 of our countries, Scotland, Wales and in England, where we are moving to indicative ballot with our members. Scotland has already started, and we will start the process in Wales and England on the 4th of November. And that's where we will take soundings from our members, because we are a member-led organisation, and we'll be asking our members very clearly what they wish to do next to try and save the health service.
Pat Cullen from the Royal College of Nursing. We've got to leave it there. Thank you.
Thank you.